Dear colleagues, I want to thank Alcon for having me here to present the Ingenuity 1.5 and actually, are there any limits in the digital visualization? So I based my usage of this digital visualization platform on a few things: simultaneous contrast concept, modified illumination, wavelength-based depth of field modification, and even we can have a fluorescent imaging. And let's be frank, when we compare the classic color image with the digital color image, there is not much of a difference, which might incline us to use digital systems. But when we develop the new opportunities for digitally modified imaging of the ocular tissues, we might have tissue autofluorescence, intraoperative fluorescein angio, ILM enhancement, fluoroscopic vitrectomy, fundus enhancement, contrast enhancement strategies can be applied, and the image of the eye can be changed to our benefit. For example, here we see a regular image at the moment. Then a digital color filter will be applied, or a custom lookup table as a LUT as abbreviation. Now you see how the fundus enhancement is based on the fundus reflectivity, which actually reflects most intensively the yellow spectrum of the light, which is longer wavelength, 577. What is the purpose of that? We see that during the chopping maneuvers, we lose the transparency of the pieces, and then the regular image, we lose the depth and how deep we are reaching with the chopper to chop these pieces. With applying a different type of filters, for example, neutral white, which is custom developed one, we can modify the contrast. We can catch the most intensive reflections from the areas of the interest. So we can better imaging actually compared to the classic analog microscope. You can see here how the pieces retain their transparency, and they are making us working more safely because we know where to chop. Now here, this is a case of hemophthalmos. Now this is a constellation control pedal of the Ingenuity. So with the 1.5 we have the functionality to use the pedal of the constellation and to change our imaging modalities, and not to ask our colleagues or nurse to do it for us. Also, we can apply image modification over the current regular image. As you can see here in the menu, we can scroll or toggle through different color imaging modalities until we find something beneficial for us. So here, how we are doing the rexis without using a dye. This is the beauty of the digital color filters. We reduce usage of the dyes in the eye, which arguably is beneficial, of course, because at least a single TAS syndrome can be avoided if the staining agent is not good enough or something is compromised during the loading of this staining agent. So less dyeing, less danger of TAS syndrome, and less toxicity. So you can see here how we can toggle the different modes. And what is interesting here, that with the new 1.5 software, there are filters which not filter all the image, just certain pixels. For example, the blue boost filter, the Ingenuity factor filter, the tissue detail mode, also the mix mode, they just enhance pixels, but not the overall image. So here you can see a contrast enhancement filter, which is a custom-made filter. Before that there was a fundus enhancement filter, now neutral white filter. So you can see how with changing the filters we obtain better visualization of the capsule and we can perform safely the rexis. This is the tissue detail mode, which is particularly useful in such scenarios. During the chopping procedures or during the chopping of the nucleus, you can see how switching in between different filters can be beneficial for us. For example, this is neutral white here, and we can still see the transparency of the nuclear pieces, albeit there is no fundus reflex because there is hemophthalmos behind. So this is the best scenario to show how we can utilize the digital filtering to help us to not use dyes in the eye. This is another example how over a regular image, when we apply Ingenuity factor, which is one of the features of the new 1.5 software, we can enhance the contrast and the highlights, and also we can see how when we prepared our own custom filter, we can even boost the performance of our custom filter with adding an Ingenuity factor over it. As I said, it enhances certain pixels, not all the picture, which is a neutral white filter plus Ingenuity factor on a different steps, so we can control how much contrast we want and how we like the image also. So here we can have a guidance. What is important to note, with Argus or with Verion, we export an image guidance and then we put it directly in the Ingenuity without the MDD unit on the microscope. And here the example must show you that even the cyclotorsion, which sometimes is in great amount, is perfectly well tracked. And here we point where the surgeon sits. Here you can see the cyclotorsion of the eye and how well the Ingenuity tracks the cyclotorsion, which is important when we are using toric lenses. So you can see that you can have a guidance of your side ports, your main incision, of course your rexis, the size of the rexis, and the position according to visual axis, pupillary pupil, and however you want to place it. You can plan the toric axis. You can see where is the steep one. You might want to do a paired incisions, as in this case, and it works absolutely amazing. So the tracking is really correct and the results are quite good. What is really important is actually the guidance of the visual axis. In the modern world, we are using a lot of multifocals and EDOF lenses. All of them perform ultimately well when they are aligned with the visual axis. If they are not on the visual axis, they might have suboptimal performance. For example, here the rexis can be guided where to be placed and also how to be made, size, position. Later on, you can also align the lens according to the visual axis, which I think is really beneficial and important in such type of surgeries. So here you can see the rexis. In this case, we had a refractive surprise where we implanted VVT, Alcon VVT EDOF lens, and we end up with -1.5. The patient was not happy, and we decided to explant the lens. Again, we relied on Argus measurements and later on Argus Ingenuity guidance, because there is no better guidance than the digital marking. So it's not manual, it's digital tracking according to the vessels of the conjunctiva and the iris registration, so it's more precise. After the implantation, you can see where the lens is already aligned because we implanted the toric lens. And the beauty is that the crosshair in the middle of this image is actually the visual axis. So we can align the EDOF element to the visual axis. So streamlining, making our life easier. And this is before the surgery, and after the surgery, the left eye was the one with the refractive surprise. Ingenuity helps a lot with the gonio surgery. You saw a regular image and then an enhanced image. And now you can see through this gonio lens how I am performing goniotomy, and you can also see quite well that plus the trabeculum, there is also a membrane over the trabeculum. So a lot of details can be seen, and for the goniotomy, at least for me, the most important thing is the visualization, because the angle is a really obscured structure and difficult to be seen. And when you see it in a large image, it's better in order to delineate the structures. You see here with the microforceps, we are removing the membrane and also the part of the trabeculum which we already excised. And later on you can see the retrograde blood outflow from the collector channels. So we opened the Schlemm's canal, and here with the help of the digital filter we also enhanced the visualization on that case. Now we can have autofluorescence. Again, it can be helpful in gonial surgery or any glaucoma angle-based surgery, because we can see the collector channels bleaching phenomenon. Here also, just to see the vessels under the conjunctiva and the resolution that the Ingenuity provides with the autofluorescence filter. So no dyes, and we have a fluorescent imaging of the blood vessels. Infrared imaging with Ingenuity 1.5. This is just to show that it's possible. So it means that the dynamic range of the camera is so large that it can actually see in the future, because probably the infrared imaging will enter the field of ophthalmology. And with the tissue enhancement, blue boost, green boost also, we can play with the image just to see how well the meibomian glands, which are infrared visible, are seen here. Also, we can apply digital filters. We can increase the magnification, as in this case. So you just the image here is just to show the capabilities of the ICM5 camera of the Ingenuity system. This is something new. Modified light from the microscope. Up to now we were using only white light. Now we can modify the light and then to apply a digital filter in order to increase the color separation, because actually we are aiming for the reflectance. So the reflected tissues, you can appreciate here how the capsule is shining and the wrinkles over the cornea. The image is getting sharper. I don't want to say that this is better, just to show that there are a lot of options. You see the wave behind the lens, and now when you chop the pieces, you actually see how they shine. So it's another modification which might enhance our visibility during the chopping procedures, where we normally lose the transparency of the pieces. So you can appreciate here the shiny structures, which makes everything transparent and well seen. You can see where are our instruments and probably work better. So here, this is my last filter, which is neutral white plus polarized light from the microscope, which brings less reflections, increases the contrast and the color separation. So you can see here also the depth of field is affected in a positive way. So I do believe that the marriage between the digital filters as a camera and the illumination of the microscope will bring the digital visualization in all one product, like all the others are doing at the moment. I believe that Alcon will provide us with a full solution combining a microscope with illumination and the Ingenuity on top of it or incorporated inside. So here you can appreciate the depth of field fluctuation because this was a reverse pupillary block, and you can see how the focus is maintained, and you can see the details and the spectacular appearance of the iris, which is really nice to be seen here. So a lot of details, a lot of contrast, and increased sharpness of the image. In posterior paw, you can see this is a regular image, and by the foot switch of the constellation, you can switch to a tissue detail mode, which enhances our tissue perception in the posterior paw also. It's not only useful for anterior segment. Here this is a case of branch arterial occlusion of the retina, and it was a hemophthalmos case, so you can appreciate the cleaning and the details that you might see here. Now after a moment you will see the opposite side of the of this fundus, and just the details are increased, so we can see better and we can work safer, I must say. You see the old hemophthalmos, the new blood collection here. Again, this is far periphery, so it's near to the ora serrata. And this is something which we are doing from 2 years already. It's intraoperative fluorescein angio in a case of branch anterior arterial occlusion. And you see that we are able to do intraoperative fluorescein guided endolaser. So we can selectively treat only the areas which are without perfusion, and we can save more of the remnant healthy retina. Here you can see a phenomenon of embolus passing and venous congestion without any perfusion in diabetic eye. This is intraoperative. After the indentation, which is physical maneuver, we see a reperfusion of the congested vein. So these are phenomena which we not normally look for or see during a surgery. This is another thing which is absolutely new. It's called fluoroscopic vitrectomy, where we are using solution of fluorescein to dye or to stain the vitreous. It's absolutely indispensable in the vitreous periphery because it stains the stroma of the vitreous, not like the rest of the vitreal staining agents, which are staining only the surface of the vitreous. So here, with extreme low concentration of fluorescein solution, we are achieving fluoroscopic visualization because we have fluorescence from the fluorescein, and that way we can clean perfectly well the vitreous, and we can also visualize all the relationships between the vitreotome cutter and the vitreous, whiplash effects, jumping of the retina, etc. Things which we don't need to anticipate like up to now. We see in real time. Here we might not use a dye at all, just a digital filter. You see here the vitreous under a digital visualization. So the filter is dedicated to highlight the collagen fibers, and you can see pretty well this vitreous. Of course, it's a matter of fundus reflectivity also. This is a case of thick epiretinal membrane, and we found that in all these cases, in the intraoperative fluorescein angio, we have delayed perfusion of vessels, peripheral vasculitis, and ischemic areas. So the term idiopathic epiretinal membranes starts to lose the ground. Here, these are the late phases of the same patient, so you can see how much leakage is there. And now, again, without dye, just with digital filter, we can see the epiretinal membrane or the hyaloid split which is there, and we can see it perfectly well in order to safely remove it from the eye. Now, there will be different filters scrolling because one of them might be better than the others, as in this example. So you will see how without any dye, again, no triamcinolone, no blue, no ICG, and the membrane is perfectly visible. You can also appreciate the depth of field which the system has, and the focus that we have. This is peeling with a biome gold lens, so it's not a contact lens peeling. And you see this thick membrane which covers the surface of the posterior pole of this eye. And as I said, if we can reduce the usage of the dyes, it might be beneficial for the overall surgery. So you might see here how well the membrane is delineated from the underlying retina, and also how this membrane is actually attached to the optic nerve and to the macula. So the surgeon should be really careful here, and yeah, you can appreciate how thick is this membrane. So probably some inflammation is going on along with the leakage and with the presumed ischemia that might exist in this eye. So I will trim this thick membrane, and probably this would be the end of the surgery. Thank you.